Hello and welcome to Module 3, Introduction to First Aid. In this session, you'll learn essential life-saving skills for responding to cardiac arrest in the workplace. We'll cover how to recognize the signs, perform CPR, and use a defibrillator with confidence. Cardiac arrest happens suddenly and silently. It occurs when the heart stops pumping blood due to electrical issues. Unlike a heart attack, cardiac arrest leads to immediate collapse. Recognizing it quickly is vital. Early intervention can double or triple survival rates. Look for sudden collapse and unresponsiveness. The person may not breathe normally or have agonal breaths. No signs of life, like movement or color, are evident. Skin may turn pale or blue-gray. These signs require immediate action. The chain of survival includes 4 critical steps. Early recognition and calling for help are first. Early CPR maintains blood flow to the brain. Early defibrillation can restore a normal heart rhythm. Post-resuscitation care stabilizes the casualty. Before starting CPR, ensure the scene is safe. Call for help and confirm someone is fetching an AED. The casualty should be on a firm surface. Begin compressions in the center of the chest. Push hard and fast to keep blood circulating. Kneel beside the casualty at chest level. Place hands in the center of the chest, interlocking fingers. Lock elbows and use body weight for compressions. Push to a depth of 5 to 6 centimeters. Aim for 100 to 120 compressions per minute. Rescue breaths are optional but beneficial. Open the airway with a head tilt and chin lift. Pinch the nose and form a seal over the mouth. Give 2 breaths, each lasting 1 second. If uncomfortable, continue with compressions only. Effective CPR requires proper compression depth and rate. Push 5 to 6 centimeters deep. Maintain a rate of 100 to 120 compressions per minute. Allow full chest recoil between compressions. Remember, cracked ribs can heal. For children, start with 5 rescue breaths. Then, follow with 30 compressions to 2 breaths. Use 1 or 2 hands based on the child's size. Compression depth should be about 5 centimeters. Call emergency services after 1 minute if alone. Infant CPR requires 2 fingers on the chest. Begin with 5 gentle rescue breaths. Follow with 30 compressions to 2 breaths. Compression depth is about 4 centimeters. Call emergency services after 1 minute if alone. Continue CPR until paramedics take over. Stop only if the casualty shows signs of life. Pause briefly during AED analysis or shock. Do not stop due to uncertainty or vomiting. Keep going until help arrives or you're physically exhausted. An AED can be used by anyone. It analyzes the heart's rhythm and advises if a shock is needed. Follow voice prompts and visual cues. Public AEDs are common in many locations. They will not shock if not needed. Turn on the AED and follow prompts. Expose the chest and attach pads as shown. Stand clear during analysis and shock. Deliver the shock if advised, then resume CPR. AEDs guide you through every step. For adults, place 1 pad on the upper right chest. The other goes on the lower left side. For children, use pediatric pads if available. If not, place pads on the chest and back. Ensure pads do not touch each other. Be aware of pacemakers or implants. Place pads at least 2.5 centimeters away. Dry the chest if wet and remove medication patches. AED use is safe during pregnancy. Always follow the device's instructions. Swap compressors every 2 minutes to maintain quality. Minimize pauses during swaps. One person should operate the AED while the other continues CPR. Communicate clearly with your partner. A third person can manage emergency calls. CPR can be physically demanding and tiring. Effective compressions may cause ribs to crack. The casualty might make noises or vomit. Most resuscitation attempts do not succeed. Remember, you're trying to save a life. CPR attempts can be psychologically challenging. It's normal to feel emotional afterwards. Seek support from colleagues or professional services. The AED records data that is useful for medical teams. Take care of your well-being post-incident. Ensure your workplace is prepared for emergencies. Know the location of the nearest AED. Check the AED regularly for battery and pad expiry. Practice CPR with your team annually. Display the chain of survival poster prominently. Worried about performing CPR incorrectly? Doing nothing is the only failure. Attempting CPR in good faith is legally protected. Push hard and fast, and don't stop until help arrives. Your actions can give someone a chance at life. Remember, your actions are crucial in an emergency.